Does Medicare cover cancer? Yes, Medicare covers a wide range of cancer care, including treatments like chemotherapy and radiation therapy, as well as preventive screenings such as mammograms and colonoscopies. Coverage depends on the Medicare plan, original Medicare Parts A and B, or a Medicare Advantage plan, with Part A covering inpatient care and Part B covering outpatient services, doctor visits, and certain treatments. You will also need to meet deductibles and coinsurance costs. What is covered? Screenings. Medicare covers routine cancer screenings, including mammograms, pap tests, colonoscopies, and low-dose CT lung scans to help detect cancer early. Treatments, chemotherapy, covered under both Part A for inpatient hospital stays and Part B for outpatient treatments at hospitals or doctor's offices. Radiation therapy, covered by Part A during an inpatient hospital stay and by Part B if received as an outpatient. Doctor visits and other services. Part B covers visits to specialists and other outpatient medical services related to cancer care. Prescription drugs, a separate Medicare. Part D plan is needed to cover cancer-related prescription drugs and anti-nausea medications. Costs and coverage details, deductibles, and coinsurance. You will likely have to meet a Part A or Part B deductible and pay a portion, often 20% of the cost for services like doctor visits and outpatient treatments after you meet the deductible. Medicare Advantage plans. If you choose a Medicare Advantage plan, Part C, it may have an annual out-of-pocket maximum to limit your spending on covered services. Coverage gap. Eliminated. For 2025, the donut hole or coverage gap in Medicare Part D was eliminated, meaning you pay a maximum of 25% of the cost for your covered drugs until you reach a certain spending threshold. For 2026, the maximum you would spend on your prescription costs is $2,100 annually. What to do? What? Check your plan details. Contact SANUS Insurance and review your specific Medicare plan, original Medicare with supplemental insurance, or a Medicare Advantage plan for its specific coverage and costs for cancer treatment and drugs. Choose a plan carefully. A Medicare Part D plan is essential for covering expensive cancer medications. Contact your provider. Always ask your doctor and healthcare providers about coverage for your specific tests, treatments, and any anti-nausea drugs you may need. Cancer policies. Consider getting a separate cancer policy. These pay a lump sum on the first diagnosis of cancer. 1 in 3 women will have cancer during their lives. 2 in 3 men will have cancer during their lives. Having a separate cancer policy can greatly help with the additional costs of transportation, seeing specialists, prescriptions, and paying other bills to ease your mind during this time. You should really consider looking into getting a cancer policy. Give us a call at 509-993-9887. Welcome. My name is Mark Sanis, and my wife Sandy and I are the owners of SANUS Insurance. We are an independent agency licensed in Washington and 11 other states. We have an office at 100 North Mullen Road, Suite 101 in the Spokane Valley. You can call us to set up an appointment by Zoom, by phone call, or even come in for an office visit. Our phone number is 509-993-9887. So why should you choose us to help you with your Medicare insurance? Well, first of all, Medicare insurance can be very confusing. Our team has over 10 years of experience in the Medicare field and even more in the insurance industry. When we meet, just ask me how many more years. When you visit with us, we will educate you on the Medicare basics and how it works, including original Medicare, Medicare Advantage, Medigap supplements, and prescription drug coverage. At SANUS Insurance, our most popular services include education. We offer comprehensive education on Medicare to help you understand your options. Annual reviews. We provide annual reviews of your health and prescription needs to ensure you have the best coverage. Policy matching. We help match your specific needs with the best Medicare policies available. Enrollment assistance. Our team assists you with the enrollment process for Medicare plans, and all of our services are provided at no cost to you. There is no obligation and no cost for our services. We are independent agents, meaning that we are not captive to just one health insurance carrier. We are appointed to sell over 45 Medicare insurance plans, so we can help you find the best plan that matches your individual needs for your health, financial, and lifestyle considerations. And we offer year-round service on any questions like claims, coverage, benefits, changing plans, etc. And as I mentioned, we offer all of these benefits at no charge to you. That's right, there is no obligation and no charge for our services. We get compensated by the carrier. Once you become a client of ours, you will receive the best experience and service. Feel free to read our 5-star reviews on Google. We really make Medicare easy. So give us a call at 509-993-9887 to review your current Medicare plan against the new ones for next year. And if you are new to Medicare, turning 65, or retiring and losing employer benefits, then you should call us right away to get educated. We're really looking forward to speaking with you.